And when our systems are strong and connected, families can thrive. When those threads fray or break apart, people can fall through those holes. And we see diaper insecurity as a very significant hole. The fact that nearly 1 in 2 U.S. families with young children struggle to afford diapers is a visible sign that our support systems aren't holding together the way that they should. Parents are forced to stretch every dollar of their household budget just to keep up with the rising costs of living. And these holes cause the fabric that holds our society together to weaken. But we believe there's a way to fix that, because when every family is supported, our whole society is held together. Today, you will hear from members of Congress who are actively advancing legislation with public policies that will strengthen the social fabric of our country and help end diaper need in the U.S. Joining us today are Congressman Jimmy Gomez, representing California's 34th Congressional District, Congressman Ryan McKenzie, representing Pennsylvania's 7th Congressional District, Congressman Rob Menendez, representing New Jersey's 8th Congressional District, and Congresswoman Brittany Pedersen, representing Colorado's 7th Congressional District. I also want to take a moment to thank Senators Tammy Duckworth of Illinois and Kevin Kramer of North Dakota, who are our bipartisan co-sponsors of the End Diaper Need Act of 2025 in the Senate. The companion bill in the House is led by Congresswoman Rosa DeLauro, who, as many of you may know, began championing legislation to end diaper insecurity all the way back in 2010. So we're going back a long way with her. On a personal note, I am very lucky to be represented in the House by Congresswoman DeLauro, and also very proud to call her a friend. We'd also like to thank Congresswoman Bonnie Watson-Cole of New Jersey for her sponsorship of the Improving Diaper Affordability Act. The National Diaper Bank Network is the foremost expert on diaper insecurity in the U.S., from state and federal advocacy to original academic research. And today you will hear from our Director of Government Relations, Lacey Giroux, and our Chief of Innovation and Impact, Dr. Megan Smith. Dr. Smith is leading the amazing work we're doing with the Urban Institute. We're also happy to have with us from the Urban Institute Dr. Heather Sandstrom and Alavi Rashid. They're going to provide a live demonstration of the new Diaper Insecurity Dashboard, which has been created through the partnership of the National Diaper Bank Network and the Urban Institute. And you guys are the very first to see a demonstration of this, so we're really excited about that. And we know that this dashboard is going to be a vital resource for advocates and for policymakers alike. It really does illuminate the holes in our social fabric and the pervasive level of diaper need at the state and county level throughout the country. We really do hope you all use it and share it widely. So thank you again so much for being here with us today, and I'd like to invite Dr. Megan Smith up to talk about the latest research related to diaper insecurity in the U.S.
Good afternoon, everyone. Wanted to thank you all again for being with us. And I first became involved with the National Diaper Bank Network when I was in academic medicine and leading work in maternal health and maternal health research, and really specifically leading work to design programs and policies that targeted maternal mental health. And it was through that work that we conducted interviews with, at that time, over 3,000 new mothers experiencing poverty. And what was really pervasive across those interviews was that there seemed to be one really key truth, was that new moms talked about wanting to make their child and their baby proud. And that was universal. And oftentimes what that meant in terms of making their new baby and their new child proud was really linked to furthering schooling, furthering education, furthering employment, getting a new job, getting a different job. And so moms talked a lot about what their goals were and what supported them meeting their goals, and also talked a lot about what got in the way of meeting those goals. And that's really where the issue of diaper insecurity emerged for me in my own academic research. And specifically, moms talked a lot about not being able to achieve the goals around work and school because they had to provide 5, 7, or sometimes 14 days worth of diapers to leave their child at childcare and then be able to go to work and go to school. And that cost often meant that mothers were making really tough choices between buying diapers, buying medicine, paying co-pays, or simply putting food on the table and keeping the lights on. And in addition to that, what we also talked a lot about with moms in these interviews was the stress and the anxiety that came with not having the sufficient supply of diapers, having diaper insecurity. And when you think, neuroscientists talk a lot about the space in your brain that you have and what takes up that space in your brain, and they talk about something called cognitive load. And not to get too in the weeds in that, but what we really heard about was when you're thinking so much about soothing a crying baby, and you know how to soothe a crying baby by picking that baby up, feeding the baby, rocking the baby, reading to the baby, and changing the baby's diaper. And if you don't have that sufficient supply of diapers to change the baby's diaper, that you don't have space in your brain, that your space in your brain is really occupied thinking about that diaper. And that's stressful, and that leaves very little room for attachment and attaching with an infant and bonding. And from a health perspective and a public health perspective, we know that attachment that forms between a mother and an infant and a baby is really critical to lifelong learning and health and well-being. And so in this way, diaper insecurity was really disrupting attachment and bonding, but also really impacting the level of depression and stress and anxiety that new moms were feeling who were experiencing diaper insecurity. And so this was really the launch of the first peer-reviewed study on diaper insecurity and maternal health that we did in conjunction with the National Diaper Bank Network, and really led to the launch of this trajectory of research from National Diaper Bank Network that Dr. Kelly Massengale, who's our Director of Research and Statistics, has been leading. And I wanted to highlight a couple of key pieces from that work. One is really around the economic impact. And so the National Diaper Bank Network has funded the Economic Impact Study, which is looking at really the economic value of diaper banks. And it's not only the economic value of diaper banks, but it's the really important role that diaper banks play in our communities. And so diaper banks are the most experienced entity often in communities who are doing this warehousing, this transporting, but importantly also this connecting with families. Diaper banks are trusted resources where families go to seek diapers and basic material needs, but also for connection to community and other social services. And at a time where, if you think about the postpartum period being so socially isolating and not having enough diapers also being extremely isolating, a connection with a diaper bank can really make a difference.
All right, so you might be wondering what exactly is in this map. So our main metric shown in this national map is what we call our diaper gap metric. We use the US Census data, specifically the 2023 American Community Survey data, to estimate the counts of children aged 3 and younger living in households with income below 300% of the federal poverty level for every US county where data are available. You may wonder why we use 300% poverty. Well, that's because about half of families in the US with children 3 and younger struggle to afford diapers, as we've heard from the National Diaper Bank in their previous survey research. And we know that about half of children aged 3 and younger live in households below 300% of the federal poverty level. So for us, this was kind of a nice, clear threshold to apply in our estimates, rather than trying to come up with a lower income level that was quite arbitrary, based on some other past work. So we stuck with that 300%. And we knew that NDBN had previously estimated that families facing diaper insecurity fell short of about 50 diapers a month. So we take those counts of young children and that 50 diapers a month estimate to determine, on average, how many diapers are needed each year to close the gap so families have a sufficient number of diapers. So that's sort of our main metric of interest to calculate for every the U.S. overall and for every state and county. Nationally, we find that it would take an average of almost 4.8 billion diapers each year to fill this gap. And again, for this metric, we use population data from the U.S. Census. We don't factor in the number of diapers that are already being distributed by basic need banks or other community efforts. We estimate how many diapers are needed overall, knowing that about half of families in the U.S. with young children 3 and younger are struggling to afford diapers. And then below the national map, you can search, just pull up you can clear the county, select it, and then you get some of the national estimates. So on the national page, we have 4 main components. First is the diaper gap estimates that I've been talking about. So nationally, you can see the number of diapers needed to fill the gap for families. You get the counts of children that we are including in that estimate, and then the number of counties that are served by basic need banks that are offering diapers. We kind of call these our diaper gap metrics. We also present metrics related to health and well-being, family financial security, as well as indicators related to early childhood services, and basic need banks offering adult hygiene products. So a lot of these are going to go into some details with select counties on those estimates. One thing I was just going to mention, if you're a data person, you might be wondering, some of the details of, what we can compare. So I wanted to just mention that for some metrics, we have data at the county and state level. And so in our metric tables, we have data that are displayed to compare the county to the state that county is in. And we're able to show for some specific metrics that have only state level data, we're able to show just the state estimates for that particular state and not the county. And I think one of our speakers is here, so I'm going to pause and turn it over to Lacey, and let me just that's all right. Yeah. All right. Thank you, Heather.
Okay, I am honored to welcome U.S. Representative Ryan McKenzie, who proudly represents Pennsylvania's 7th Congressional District. Congressman McKenzie serves on 3 key House committees: Education in the Workforce, Foreign Affairs, and Homeland Security. Prior to his time in Congress, he served as a member of Pennsylvania House of Representatives for 12 years, where he passed legislation to improve health care and create opportunities for families to thrive. Congressman McKenzie is a co-sponsor of the bipartisan Improving Diaper Affordability Act, which aims to ease the financial burden on families. Please join me in welcoming Congressman Ryan McKenzie.
Good afternoon, everybody, and thank you to Lacey for that kind introduction. It's such an honor to be before this group today, and I appreciate all of you being here as you learn about what we're doing here in Congress and the ways that we can improve the lives of working families all across this country. And as was stated in the introduction, I'm Congressman Ryan McKenzie from Pennsylvania's 7th Congressional District, centered in the Lehigh Valley. So the main city in the area is Allentown, Pennsylvania, so an hour north of Philadelphia, and the district runs up against the border with New Jersey there. These issues are personal to me. I always tell my personal story because I think it shows not only that I understand these issues, but also how it translates our personal experience. Like everybody in Congress, your personal story translates to the work that you do here. And so my wife and I were blessed. We have our first child, a 1.5-year-old son named Leo, and she is pregnant with our second child, a little girl that's going to be coming in December. And I know from my time as a state representative on the campaign trail that cost of living issues are far and away the #1 issue that people are facing across our country, and that's whether they're working families and people with young children, or seniors, or anybody who's single and still living on their own. For everybody across the spectrum, cost of living, whether it's housing, healthcare, food, fuel, all of those things. But it is a particular challenge that we see for young families and working families trying to raise children in an age with those high costs. And then I also see, as somebody who's on education and workforce, the impact that it has on the other decisions that they make in their lives. And so all too often we hear about how the high costs of childcare force a decision. Not allowing the decision to be made, but force a decision for working parents to exit the workforce because they say, hey, and they're making a I always say they are making a rational economic decision on their own. They're saying if I go to work for 40 hours a week and this is my take-home pay, minus the cost of childcare for 2 children, there's not much left at the end of the day, so why would I be away and out of the house and away from my children for that? But then that has an impact and ramifications for our workforce, and that person didn't get to make that choice, so it was kind of forced upon them. But then also, again, employers we know are in many instances struggling and looking for employees, and if you're removing individuals from the workforce because of that forced decision, not helpful for the individual, the family, or businesses in our overall economy. So what are we doing to address that? Here in Congress, obviously affordability, again, is the top issue for me, and so I introduced a working families tax package as the first package of bills when I was elected to Congress last November. And so in February, we introduced a 4-bill package. The first thing was expanding the child tax credit that would help everybody with children. That was something that we were able to get somewhat included in the reconciliation bill. We appreciate the expansion. I would have liked to have seen more, but we appreciate that it went to $2,200, and that it will escalate with inflation. So previously, it was set to go back down to $1,000 per child. So significant increase, beneficial, but we would still like to see additional increases, and also potentially changing the way that tax credit can be realized by individuals. Instead of seeing it all realized on your end of your tax return, are there ways to kind of have that paid out or received by getting credits or reductions for your payment for taxes that you're making in every single paycheck? So continued work in that space, but that was item number 1. Item number 2 was that we would like to see also an expansion of paid family leave. And so there is a structure and a mechanism that's very popularly already in place now, where, and it was renewed in reconciliation, the businesses can get up to a 25% tax credit if they offer paid leave. That's nice. I'm going to continue to push. Our second bill in the package would have expanded that to 50%. And some states and local entities have their own components of that as well. But ultimately, the goal would be so that you could totally offset the cost of a business giving that paid leave to an individual, because we understand there may be a need to find a replacement worker or somebody to fill in part-time. And so if you can work towards totally offsetting that cost for the business, it makes it much more likely that they're going to offer that paid leave to all of their employees. And so I want to continue to try to advance that topic. The third was around childcare, which we talked about, expanding the child and dependent care tax credit. Again, we were able to do some things around eligibility and reconciliation, but we would like to continue to see an expansion on that. And then the fourth bill was that I had introduced a tax credit for IVF that would go along with the adoption tax credit. And so the adoption tax credit's already in law. We would like to see an IVF tax credit included there so that families that are planning to grow their family, regardless of how you would like to do it, could see the offset of costs through a tax credit for IVF. And at least in Pennsylvania, I don't know, don't want to speak to everywhere around the country, but the challenge for IVF, individuals seeking IVF treatment in Pennsylvania is not access to care, it is cost. They can go to lots of different facilities, but if they don't have the resources, it's not going to be an option for them. So the way that we would propose to offset that is through the IVF tax credit. Now, all of those things that I talked about are in the tax space, and that's because the reconciliation legislation that we were considering for the first couple months was a tax and spend proposal, so all things needed to be in the tax space. But there is a lot more that needs to be done, and we're going to continue to work on outside of the tax space, just because we believe that while these are certainly economic decisions that people are making, there are also all kinds of other contributing factors. We know mental health and substance abuse sometimes play into these challenges that families are facing, lack of healthcare and transportation, and all of these other things come into play. And it's always these confluence of issues. So we're going to continue to work on these space, and I did want to mention one final bill. It's not my bill, but I think it is one that shows the bipartisan nature of these issues in a really common sense item, which is House Resolution 3128, specifically relating to diapers, the Improving Diaper Affordability Act of 2025, which would allow diapers to be a qualified medical expense under HSAs, FSAs, HRAs, all of those things. Super common sense. We have those mechanisms already in place. I utilize them, our family, so many others utilize them, but to say that diapers don't get covered under that doesn't make a whole lot of sense. And so we need to continue to advance this common sense policy because, I think, and the great thing about Congress today is that I see my colleague Brittany Peterson in the back. She'll be speaking as well. You are seeing more young families and young representatives coming. It is still an incredibly old body. We know that, we recognize that, but there are younger voices coming, and so hopefully those younger voices match the challenges that working families are facing. So with that, I will wrap up, but just want to say thank you for all that you're doing here by being here today, recognizing these important issues, learning about the data and the things that we can do to improve the situations, and then collectively working together to actually make real change here in Congress. So with that, just want to say thank you again and enjoy the rest of your day.
Thank you so much, Congressman McKenzie. Thank you for taking the time to be here. Next, we're honored to welcome U.S. Representative Brittany Petterson, who has proudly served Colorado's 7th Congressional District since 2023. Before joining Congress, she dedicated a decade to public service in the Colorado State Legislature, first in the House and then in the Senate, where she secured the first ever funding for diaper distribution in the state of Colorado, which has continued since. Serving on the House Financial Services Committee, Congresswoman Petterson has drawn from her own experience of overcoming adversity to champion affordability, mental health services, and opportunity for working families. Please join me in extending a warm welcome to Congresswoman Brittany Petterson.
Hi, everybody. So good to see you here. My name is Brittany Petterson, as she said. I represent Colorado. Anyone here from Colorado? All right, well, I'm still excited to see you. I am a mom, and it is a rare thing to be a mom in Congress with 2 young kids. I have a 5-year-old and a 7-month-old, and it has been a journey. I've always cared about these issues before having kids, but it is especially important to me after when I first gave birth to my son in the state Senate. I remember reading a story in the Denver Post in one of our state papers around these families across Colorado who were unable to afford diapers and were using trash bags and duct tape, and the impact that had on their ability to go to work, to care for their kid, to make sure that they were dry, clean, and healthy. And so I worked alongside my colleagues to bring the first state funding at the state level to dedicate $2 million a year to diaper banks. And that's how we decided it was the best way for distribution across the state. We know that there are much broader issues and systemic changes needed to address families' inability to pay for diapers for their kids. But this is something that we led on in Colorado, and something that I look forward to addressing here at the national level when we get to back to addressing challenges instead of creating them. No laughs? But something that was staggering for me, my team is amazing and put together an overview here. You already have it highlighted, but 1 in every 2 families face diaper insecurity. 25% of families report that they missed an average of 5 days of work or school because they did not have enough diapers to send their kids to childcare. That is absolutely heartbreaking. When I think about the amount of only 66% of mothers with infants in Colorado are in the workforce. And we know that there are 10,000 moms in Colorado who would like to be back to work, but they don't have access to affordable and accessible childcare, let alone, their basic meeting their basic needs with diapers. So
what you all are doing is so important because for the first time, we'll actually be able to see in real time what the needs are across states and counties, and really try to put pressure for change at every level of government in prioritizing the need for diapers. So it's a very important first step in bringing and shining a light to the issue that you all are working to address. And I'm just excited to be able to come here and say hello as a mom here in Congress. It's hard to believe I was the 13th voting member to ever give birth while serving in Congress. There's a reason. This place isn't made for us. It was never, we were never considered when it came to serving in Congress. And so we need to change the voices here and the priorities and making sure that we are elevating the needs of families. So I just am so grateful for the work you all are doing every day. And Sam, if you followed any of the news with when I took my son here to Washington when I was unable to vote remotely after giving birth, we were on the wait list for childcare. I know we're not talking about childcare, but we're talking about needs of family. But we were on the wait list for over 13 months before he finally had access to his childcare slot. So he is not with me today, so I'm sorry you didn't get to meet Sam. But when I think about the importance of diapers, that I haven't been in the position where I was unable to afford it, of course, I'm always shocked at the cost of formula, the cost of diapers, the rising cost of childcare, all of the reasons why people are choosing not to start families. But the times where I have failed to bring enough diapers when I'm out in the world or here at the Capitol and trying to adjust for that and trying to figure out how you're going to meet that need, I can't imagine what families are going through every day that are facing that. And so we need to make sure that our kids are taken care of from day one, that our moms are able to be in the workforce, and that our kids are dry, clean, and healthy. So thank you all for the work you do. Thank you for having me here to come and say hello. Oh, I love that.
Thank you so much.
Oh, sorry. Thank you so much. Oh yeah, you're gonna introduce him. I was gonna welcome Jimmy. Thank you so much, Congresswoman, and we hope to meet Sam soon.
Yeah.
We are honored to welcome U.S. Representative Jimmy Gomez, who proudly represents California's 34th Congressional District. Congressman Gomez serves on the influential House Ways and Means Committee and is the founder and chair of both the Congressional Dads Caucus and the Congressional Renters Caucus. Through the Dads Caucus, he has championed the importance of fathers stepping up, both at home and in the halls of Congress, while also shining a spotlight on the needs of working parents across the country. Please join me in welcoming Congressman Jimmy Gomez.
The whole stepping up in home and the halls of Congress is, my wife uses it as leverage often to make, listen, I just want to say thank you so much for the work you're all doing. It's really important to bring the information to the lawmakers, to the staff, so that they understand what's really going on. Sometimes we get into our own little bubbles and our own little experiences, and that often tells people that things are better than they are, right? That families are getting by, or it's not as bad. And diapers are one of those issues. Until you're in it, literally in it, you don't really know what you're dealing with, how much it costs. Becoming the father of my son Hodge 3 years ago, he just turned 3 in August. We got him a t-shirt that said young, wild, and 3, because if you have a 3-year-old boy, you get it, or a 3-year-old girl, they tend to change your perspective and your experiences. And I honestly, being the youngest of 6, I didn't know how many diapers a baby would go through. And I do actually miss the days of the early days when those wasn't too bad, right? But you really start seeing how much the prices are increasing just month after month, since not only 2002 since I became a parent, but especially nowadays with the implementation of the tariffs, where you're seeing this baby tax really just impact working people. If we feel it, my wife and I feel it, and we're pretty well off compared to others, I have no doubt that other families are feeling the pain right now. And we as Democrats, I think, missed some of that pain last year when the economy was getting quote unquote better. The pain never stopped because the prices never went down. And then with this Trump administration's, I think, fundamentally flawed idea of how do you lower the cost of prices on day one, make America affordable again, is actually doing the opposite. And you're just seeing it time and time again. The diaper situation, as you all know, how many diapers a family goes through, how much, like it used to, at least a few months ago, was $45 for a big box. Now my son's going through potty training. He's been going through potty training for a while now. He's no longer in diapers. He's in regular underwear, but he wears pull-ups at night and during his nap. And even those are still pricey. So it's that crushing weight of not only a full diaper, but a expensive diaper on that family. So we want to tell the stories so people understand what it means. You know, if you probably had a statistics on like diaper rashes, who has more diaper rashes, you're probably looking at the lower rungs of the economic ladder. If you want to look at any kind of infections, you're probably looking at the lower cost of economic ladder. People that change them less, lower runs of the economic ladder. My wife and I, you know, we just change. But a lot of families can't do that, and you see it. The other day I was visiting a family who had a wife, a mother, and a daughter who was 20 years old, just had a baby, and this was regarding the immigration raids that were going on, where the dad, who had a taco truck and was arrested in a raid, was taken away. Now the mother, who also used to work, now is afraid to leave. And then what I saw behind them was a pack of diapers from baby to baby, right? They get donations, they fundraise, they actually strip down the basics of the diapers so that they can give out more. So the family that was already struggling is going to be even hit harder because of these raids. So those were the same families that we see getting impacted by the increasing costs. So we have to do more to repeal the baby tax, but a lot of those tariffs that are just increasing the price of car seats, the price of shoes. 99% of all shoes are made outside the country. So the price of clothes. I was joking around with somebody that you know, instead of traveling to Mexico for cheap pharmaceuticals, we're going to be going for clothes, shoes, and diapers because it could be a lot cheaper in Mexico than the United States. So this issue right here is part of a bigger issue that the average American family is struggling. They feel like they're getting worse off economically. And that means that they're having more despair, but also losing faith in how our system of government actually works. They're connected. When people are struggling and they say, hey, they see a big billionaire bill or a big beautiful bill that gets passed that takes away their health insurance, takes away their food stamps, and then gives tax breaks to the billionaires, no wonder why people are pissed off and why the Republicans are trying to figure out how to rebrand it as working class family tax cuts. We know that's like complete BS. And I hate to get political when you guys are doing good work, but it's easy to show up to talk about diaper banks because it's what people think is being good and neighborly. But then when you're undercutting that family survival on the other end, I think it's just plain cynical. So, and yes, I'm passionate about it because I see it, how it's impacting people throughout the country. But in the end, we need these statistics. We need you to talk to the Republicans I can before I get annoyed with them and walk away. And we need you to kind of bring home what these cuts mean and bring home the crisis when it comes to just raising the family. People like to talk a big game about family values, but then actually pass bills that value families. And that's what I'm kind of trying to do here. But keep up the good work. We need this data, and then we'll keep sharing it. But our group as Dad's Caucus, 45 members strong now. 3 senators, Andy Kim, Adam Schiff, and Ruben Gallego, who just had a little boy. And we feel it every single day. And we come from backgrounds that, at least Ruben and I do, that we don't come from wealth. We come from families that looked out for one another, took care of each other, even if we couldn't, the families couldn't provide the diapers. Back in my day, it was a different game. It was cloth diapers. Now those are progressive again, I guess. They're kind of looked down upon back in the 1970s. But that's kind of what we're going to be pushing for. And you're going to hear from next a member who is fighting the good fight with the Dad's Caucus, but also we're authoring a bill that would help small businesses with changing tables. Because once you have a diaper to change, we need to find a place to actually change them. Who hasn't changed a baby on the floor of a bathroom, right? So, or try to do some kind of juggling act. So thank you. Keep up the good work, and you'll look forward to hearing from your next speaker. Thank you so much.
Thank you so much, Congressman Gomez, and thank you for your continued advocacy. We're honored to be joined today by U.S. Representative Rob Menendez, who represents New Jersey's 8th Congressional District. Congressman Menendez serves on the House Energy and Commerce Committee, where he works in the Communications and Technology, Energy, and Environment subcommittees. He's an active member of the Congressional Dad's Caucus, as you just heard, and is a champion for policies that strengthen families and ensure children have the resources they need to thrive. Please join me in welcoming Congressman Rob Menendez.
Thank you so much for having me today. Thank you to the National Diaper Bank Network, the Urban Institute, and all the advocates who have joined us for this important conversation. Like Jimmy, I come on the heels of 2 important announcements. One's personal, which is that my youngest child is now out of diapers, which means I'm also out of pocket on little construction toys to give him in his pursuit of diaper independence. And it's an incredible time as a parent when your children are that young. Before coming to Congress, I volunteered with a number of organizations in the county that I live, Hudson County, that we're trying to provide excess diapers that kids had grown out of to give to community members who are struggling with affordability, providing diapers for their families in addition to adult hygiene products, which is another challenge that so many people face in our communities, and really, which is a baseline sense of equality, that to have this conversation in 2025 is extremely frustrating. But there's a universe of people here, largely in one party, who are committed to the work. And as Jimmy mentioned, we're introducing a bill next week that will create a tax incentive for small businesses to install changing tables. Again, an accessibility issue for families, especially, my wife and I talk about this a lot. Raising children in this moment should be such an incredible opportunity. We know how to create better educational outcomes for kids. We know how to create better health outcomes for our children. We know that the expanded child tax credit lifted 50% of children out of poverty. We know that the reason that was successful is because, unfortunately, so many of a child's learning and health outcomes are determined by their parents' socioeconomic status, which has nothing to do with that child. Right? It's just the family they were born into. And we also know that anytime you give a parent extra resources, they will invest it into their children. Whether that's housing, giving them a stable place to live, whether that's access to health care to make sure they're getting all their regular appointments and checkups, or ensuring that they have the ability to constantly give them clean diapers, which is such a critical thing for families and for children. So there's a lot of work to do. We're in a challenging moment here from a funding perspective. The cuts to Medicaid and how many births in this country are covered by Medicaid, how it ensures a quality birth for the mother and for the child. We're in a tough place. But we also know, because of your advocacy, we're on the precipice of doing such incredible work. And it's frustrating to be taking steps back, but at the same time, we can't lose sight of how close we are to really leveling the playing field. The dashboard that you all have created will give us a better sense of the challenges that families across the country are having, and we can better advocate as members to all of our colleagues that this is not a Democrat or Republican issue, a black or white or brown issue. This impacts all Americans. And so we should be able to come together. We should be able to close the gap in the number of diapers we need for all families across the country to make sure that they are affordable. We're right there. And it is admittedly very hard to be taking steps in the wrong direction, but I will never lose sight of where we need to go, where we will go, and I know that we'll do it together with your advocacy. So thank you all so much for having me, and thank you for all that you do. Thank you. Thank you. Thank you, everyone.
Thank you so much, Congressman Menendez. And I just want to welcome up Alavi Rashid to do our county insight here.
Thank you, Lacey, and thank you to all the wonderful members of Congress that have spoken today. So I'm just going to give a really quick demonstration of one county as an example county we picked out. So as a reminder, if you want to find any specific county, you can sort of mouse around the map and click. But I'm actually going to type it into the search box. I'm going to choose just complete the county selection. So I've chosen Maricopa County, Arizona. So first and foremost, NDBN member data is integrated throughout this dashboard. You can see it both in the child diaper gap metric. In the case of Maricopa County, that is about 66 million diapers for the county at large, and 110 million for Arizona. So further down, we can also see the presence of NDBN members who distribute period products along with adult incontinence products, which I'll get to in a moment. But as we sort of look around, we can see the child diaper gap is right around here, and as well as the number of children aged 3 and younger who live in households which may struggle to afford diapers. We also have contextual information around health and well-being in this tab, in this section labeled health and well-being. Things like the maternal care desert rating per the March of Dimes, which indicates whether a county is in a region which lacks access to maternal health care resources, such as hospitals or healthcare providers that specialize in obstetrics. There's also metrics at the state level, such as share of births paid for by Medicaid and CHIP, or assigned children that are under CHIP, along with babies born with low birth rate, which is important context to the overall landscape of maternal and child well-being. Here we can see that we have at the state level the percentage of counties served by basic needs banks which offer diapers. In the case of Arizona, it is actually well above the national average of about 50% at 80%, as well as access to early childhood services. So things such as childcare cost burden for a household with 2 children. You can see that Maricopa County is about in line with the national averages, as well as factors around children enrolled in Head Start or nursery programs, as well as if the county has at least one local implementation agency offering early childhood home visiting services in line with those from, for example, from the Federal Maternal, Infant, and Early Childhood Home Visiting Program, or McFeed. There's also, of course, reading and math proficiency scores for children in 3rd grade, and I think these are just really helpful in providing that background contextual fabric to everything around diaper insecurity and showing that what the day-to-day life is like for families experiencing diaper insecurity. We also have a number of financial well-being metrics, so things around what could influence if families in a county can afford basic necessities. Things such as the gap between the 80th and 20th percentile in terms of income, the percentage of households which have maybe $2,000 in emergency savings, unemployment rate, home ownership rate, severe housing cost burden, TANF coverage, and whether or not a county is rural, because there is quite a big difference in things like, for example, the maternal care desert rating between urban and rural counties. Lastly, down here at the bottom, we can see that in Arizona, basic needs banks also distribute about just under 1 million period products in 2024, serving about 3,000 people. And you can see here the percentages of counties served by basic need banks offering period products and adult disposable briefs. So that was just a quick overview. If you want to learn more, you can read the technical appendix, and I'll hand it back to Lacey for some closing remarks. Thank you.
Thank you so much. Thank you so much, Alami, and thank you all for being here today. I know we are at time, but we cannot leave here with talking about what's next. Where do we go from here? And so I just want to talk briefly about the federal policy opportunities and solutions that are within reach. First being the End Diaper Need Act, which is sponsored by Senator Duckworth and Senator Kramer in the Senate, and Congresswoman Rosa DeLauro and Congresswoman Bonnie Watson-Coleman in the House. It would authorize $200 million annually to organizations providing diapers. This funding would allow for established basic needs banks to expand their reach to help close those gaps that you saw on the map and will continue to see as you look deeper into that map. It would also do this in a sustainable way. Additionally, the Improving Diaper Affordability Act, introduced by Congresswoman Bonnie Watson-Coleman and Congresswoman Rosa DeLauro, would treat diapers as qualified medical expenses under HSA accounts and prohibit state and local sales tax on diapers. Unfortunately, 23 states are still taxing diapers. We also know that there are additional pathways to provide support and address diaper insecurity. First off, we recommend using TANF for diapers. TANF benefits are often too low to cover essentials like diapers after rent, food, and utilities. But states may allocate TANF funds to diaper banks to provide diapers to TANF eligible families. And states may provide additional stipends or vouchers that families can use to purchase diapers directly. Another opportunity is covering diapers under Medicaid for children under age 4, which would be a targeted cost-saving investment. This would help prevent unnecessary emergency room visits, reduce acute infections, and improve both child and maternal health outcomes. 2 states are already covering diapers under Medicaid programs, but a federal approach is necessary. Providing direct federal funding for diaper banks is an important path forward for addressing diaper insecurity. As Joanne mentioned, there are over 300 basic needs banks that are part of our network. They are trusted, proven community partners with expertise in purchasing, storing, warehousing, and distributing diapers and related supplies. Direct federal investment would provide the sustainability diaper banks need to meet growing demand and ensure they can reach every family in need. We also know that providing diapers in conjunction with MCV home visiting programs is an option that works. In 2021, emergency funding briefly allowed MCV programs to provide diapers, wipes, and rash cream, often in partnership with diaper banks. Families benefited tremendously. This proven model should be made permanent and include diaper banks as key collaborators. And looking at child welfare reform, there's an important opportunity to strengthen prevention services by requiring states to include diaper provision in their Family First Prevention Act or prevention plans. Ensuring families have concrete supports like diapers can reduce stress and keep families safely together. Finally, military families with young children often face unique financial challenges, including frequent relocations and deployment-related disruptions. Diapers are a significant and unavoidable expense, as you've heard today over and over again, and as many of you know. Yet they're not covered by existing military benefits such as the Basic Needs Allowance. Congress should provide dedicated federal funding for community-based diaper banks to partner with military installations and family support centers. Together, these recommendations and bills represent a comprehensive approach, meeting immediate needs while also creating sustainable, long-term solutions. Our ask is simple but urgent. Please support and co-sponsor these bills and work with us to ensure diaper insecurity is addressed in every federal program that touches the lives of young children. On behalf of the National Diaper Bank Network, I want to sincerely thank all of you for taking the time and a little bit over time to join us today. Thank you for your leadership, your time, and for standing with families. We hope that today's conversation underscored both the urgency and opportunity before us, and we look forward to connecting with each of you as we work together to end diaper insecurity in the U.S. Thank you.